afternoon, everybody. We are so excited to have you here today. Today is the third Friday of the month of November, and on the third Friday, we talk about careers. And so I am going to hand the mic over to Ms. Reese Perez, who's going to talk about today's special guest. Reese, take it away.
Thanks, Miss Mary. All right, today we have a really special guest with us who is going to help us dive into the medical world. She is actually, I'm going to let her talk about her connection to our school. But I wanted to first have her introduce herself. Her name is Miss Nancy Bravo, and she is a physician's assistant. So, Miss Nancy, if you could introduce yourself and tell us a little bit about yourself, and make sure you don't leave out any of the fun facts.
Of course. Hello, my name's Nancy Bravo. I am a physician assistant, and you're probably wondering what that is, but I'll go in a little more detail. But was born in California. I've been a physician assistant for the last 13 years, two kiddos who are super amazing. And fun facts about myself is that I love doing triathlons, which I'm not sure if you guys know. It involves a sport that has swimming, biking, and running. And then I love doing ultra running. And I've done a 100-mile run in one day. I know, crazy, right? But I love to be active. And another fun fact is that my sister is Miss Wendy Marone. So that's a cool, hopefully, fact. But that's a few things about me.
Awesome. Okay, I had no idea that you had done a 100-mile run in one day. How long did that take you?
24 hours.
Oh my gosh. Okay, so it took a full day.
Yeah, from day till night, overnight.
Holy moly. Did you run somewhere in California that we would know?
It was, so it's in the middle of somewhere called Temecula and Palm Springs, and it's just a very woodsy area.
Okay, gotcha. All right. Well, okay. So, I mean, that makes sense. Being in the medical field, you'd want to stay, active and healthy and all the things.
Yeah.
But how would you describe what you do?
So, as a physician assistant, I am able to help manage, help treat patients. I work with a group of doctors and we work as a team. So, I work under a doctor, but I'm able to see patients in a clinic on my own. I'm able to treat them, order studies for them, prescribe medications. My specific role as a physician assistant, I work in orthopedic surgery. So I see patients in the hospital either with broken bones, infections, or recovering from, surgeries. I'm able to, help patients when they break their bones and try to get them back into the right place. It's a great field, honestly. It's so rewarding, and I truly love what I do.
Okay, so what is the difference between like nursing and then a physician's assistant and a doctor?
So nursing, they help patients and they work under a physician assistant and a doctor. As far as a PA, we're able to do very similar things as a doctor, like, order, imaging, testing, prescribe medications. But we have to work under a doctor as a mentor or a guide, which is what I love, because if I get stumped on something with a patient, I'm able to collaborate, talk to a doctor, and kind of get advice on how to go about treating, a patient. Obviously, with being a physician, you definitely have to go to school longer, and there's more that's involved. But for myself, being a physician assistant, the school is not as long as being going into medical school, but I'm still able to treat and help patients.
That's super cool. So, what led you down this path? How did you arrive at becoming a physician assistant?
Well, my path wasn't super direct. I knew I wanted to go into the medical field. I just didn't know exactly what I wanted to do. I was thinking nursing, and then I was thinking maybe I want to be a doctor, but I didn't want to go to school for that long. And in my pursuit of trying to figure out what I wanted to do, I found out what a physician assistant was, and I fell in love with it. I was able to shadow and see what they did. And then once I figured out what I wanted to do, I went to school and took, the prerequisites and got my, my bachelor's and then my master's in physician assistant to, do what I do now.
That's awesome. Okay, so what were the requirements and education and skills necessary to get here? You mentioned your bachelor's and then your master's in physician assistant.
Yes. So I got my bachelor's in healthcare administration, which it really did help out kind of trying to figure out how the whole medical system works. And then I took extra classes to do the prerequisites for physician assistant. Then I got the master's in physician assistant. But before applying to the master's program, I did have to do volunteer work and, paid hours in the medical field. Before I got into the physician assistant school.
Very cool. Would you say that there's like a specific skill set that you would need to have going into this profession?
Honestly, as far as the skill set, they'll teach you everything in school. You just have to have the drive to want to help people. And then once you're in school, they teach you everything, honestly. And I think that's what I love about being a physician assistant. Did I disappear?
Nope, you're still here.
Good. The thing that I love about being a physician assistant, there's so many specialties in the medical field. There's, rheumatology, internal medicine, dermatology, orthopedic surgery or pediatrics. But as a physician assistant, you can go into different specialties as long as they train you. So for 5 years, I can do orthopedic surgery. And then if I decide, I want to change it up and I want to do something different, I can go into dermatology as long as I find a doctor that wants to train me. And so it's just being able to adapt. And that's what honestly the medical field is. It's always learning and being able to adapt because it's always changing. So it's always good to educate and relearn stuff and always learn new stuff too.
Totally. It keeps you, you're being a doctor and being a physician's assistant. It's different every day anyways, I'm sure. But like being able to like switch your genre, right?
Yeah.
That's amazing. I love that like one day you could, or for a couple of years you could do one thing and you're not locked in. Whereas
No.
being a doctor, right? Like if you're a pediatric doctor, that's your specialty for the entire length of your career. But that's really cool. I had no idea. So you
Yep.
can just bounce around.
You can't, you don't want to bounce around so much, but yeah, you can definitely, after so many years, be like, you know what? I definitely want to look into dermatology or I want to look into pediatrics. You can definitely change at any point. But the longer you stay in a certain area, you become more knowledgeable and just more, you develop better skills at the area that you're in.
That's super cool.
And that's why I love this, honestly, so much.
Yeah. So at what point let's say you're working with a doctor and do you guys have patients together? And like at what point would you interact with a patient versus a doctor?
So my specialty is orthopedic surgery. So the surgeons will do surgery and I'm able to go into the operating room with them as well and help them with the surgery. I'm not able to do certain things like with the saw, but I'm able to close sutures, the incision, retract. And then afterwards, I'm able to help the patient in the hospital. So make sure their medications are good, interact with the internal medicine doctor, their physical therapist, so the patient can continue to get better. All along while I'm collaborating with the surgeon who did the surgery. But we work as a team.
Awesome. So what you've touched on this a little bit, but what do you like about what you do? And is there anything that you dislike?
So honestly, I love everything I do. I love seeing patients get better. I love them getting back into their normalcy because sometimes they have injuries and they're not able to do certain things, but with encouragement medications and the right track, they're able to get to where they need to be. And I love that. What I dislike is obviously, patients having injuries and death. That to me is hard, but it's part of life, but it's hard to still accept at times.
Yeah, absolutely. I'm sure. But what I can hear out of that is that patients are, the most primary concern for you. And that's really big, I'm sure. But on that note, what is the funniest or most memorable story that you have with a patient?
Okay, I'm going to tell you a really funny story. So,
Okay.
um, in the they'll call us for certain consults. That means they need help with something that's our specialty, which is orthopedics. So we have joints, like our shoulder is a joint, and our, elbow, and our knees and our hips. And so sometimes your joints can come out of place. And so they called me to get a hip back in place. And in order to do that, you have to go on top of the bed when the patient is sleeping. They got medications and they're resting, but you have to go on top of the bed and try to get the hip out. And I was about to go to lunch, so I put my credit card in my pocket. And so I was trying to get, I was over the patient, trying to get the hip, back in, and, got it back in. It was perfect. The patient was happy. I was trying to go to lunch, and then I was like, oh no, my card's gone. And then they called me and they're like, Nancy, your credit card was in between the patient's legs. I'm like, oh, hey, don't put your card in your pocket next time.
Oh, that's so funny.
Yeah.
Oh, she's
Was
gonna
Was
bill
that
you for the
embarrassing?
procedure.
What's that?
I said
Was
she's
that
gonna bill
embarrassing when
you
you
for
got
the
your credit card?
procedure.
Yeah.
Oh, that's so funny. So, what is a big, like a common misconception about what you do? Uh-oh, Nancy, you're muted.
There we go. Okay. So a common misconception is a lot of times when I introduce myself, patients will think I'm a medical assistant, or that I'm a nurse, there's nothing wrong with it. But I feel like a lot of times patients or just people don't know what a physician assistant is and what they're able to do. So, that is probably one of the misconceptions that I always get associated with being like a medical assistant.
What would you say has been one of the biggest or the most unexpected surprises about your job?
So as far as my job, going into school, you are introduced to so many different, areas in medicine. And I never thought that I would go into orthopedic surgery. I didn't think that was for me. I was like, maybe I'm going to go to OB-GYN and help deliver babies, or I'm going to go into neurology. I just love the way the brain functions. And I said, I'm never going to do orthopedic surgery. And somehow I stumbled upon a job with orthopedic surgery. Someone convinced me to look into it, and I honestly love it. Love it. So never say never. Always keep an open mind, because you just never know. I mean, there's so many things out there, and it's sometimes we're just like, no, it's not my thing, but you get immersed in it and you end up just loving it. So
That's so funny. Was there a specific draw?
for orthopedic surgery,
Yes.
in the beginning or now that I'm in it?
In the beginning, like what was the initial spark that you were like, yes?
It wasn't. I was just like, you know what? Okay, I'm willing to learn and let me see how it goes. And once I was in it, I was like, I love this. I love encouraging patients to get better and helping them. And I love being active. And I think that it just went with who I am and what I like to, how I like to represent myself. So it definitely was something that I was very excited about, and still I'm very excited about.
I love that. Super cool. All right. Well, I have one more question for you before we open it up to the panel. We've really flown through these quickly. But what advice do you have for young people that are looking to get into the medical field or looking to get into specifically physician assistant as a career?
So honestly, my biggest thing to tell anybody that wants to get into the profession is, it's not, I mean, grades are great. You have to keep your grades up, but you have to make sure that you're able to manage your time and be able to give to the community, volunteer, and keep an open mind, because there's so much out there, honestly, in the field. But never give up. That's one thing I'm going to say, never give up. When I applied to PA school, I didn't get in the first time. And I felt like May was a blessing because I was able to work on myself in different ways. But it was something that I really wanted. So if a door closes, don't worry, another one will open up and it'll be the right time. But it is, I mean, just make sure that you work towards what you want.
Good advice. Super good advice. All right, everybody. I'm sure you probably have a few questions. If you would like to raise your hand, you can just ask your question directly. Or if you have a question you want to pop in the chat, that's okay too. And then my last question for you, Nancy. Are there opportunities for kids who are looking to volunteer at the high school level?
Yes, it's called shadowing. So you can definitely ask to shadow, shadow, either a PA or even a doctor if you wanted to, see what the difference was. I always suggest to kids, or students, like, look into it before you go into it and make sure this is something that you want to do. And it's so rewarding just going there and seeing what's involved and how we're able to make an impact on patients to get them better or figure out what's wrong.
All right. Well, Miss Nancy, we want to thank you for joining us today and for answering our plethora of questions and especially on last minute notice.
Oh no. And if
and
anybody had a question or anything, I'd be willing to give like my email. I mean, I'm always open to helping out in any way that I can. So.
well, we appreciate that. We have a lot of students who are really interested in the medical field. So I think a lot of questions got answered today.
All right. Sounds good. You guys have a great day.
Thank you so much. You too.
Okay, students, hold tight. We are grateful for Miss Nancy today, and I'm going to share my screen so that I can resume some of this information that I want to give to you. Oops, my screen just went black all of a sudden. There we go. All right, so some of you were asking what is today's title. So today was a career conversation with physician assistant Miss Nancy Bravo. So that was what we just wrapped up. Ms. Reese, awesome job. I should have gone over the meeting norms ahead of time, but you know them. You're doing great. You're rocking this. So that's great. I do want to point out some upcoming events. So to let you know that on next Tuesday is the end of LP3. So be thinking about this. If you are on a semester course, you should be 3/4 of the way finished with your semester course by Tuesday. Okay, so are you where you should be? Kind of be looking at your courses over the weekend and see where you need to be. If you're in a year-long course, you should be about 37.5% finished with a year-long course, okay? That kind of gives you the math part of it. Also, we're all looking forward to fall break. Fall break will be coming up on November 25th through December 2nd. So we will have all next week of classes, and then the week after that, plus the Monday after that, you are going to be on fall break. And I see a student with a hand raised, but don't say anything just yet. Wait till I finish the recording, okay? So the next thing I just wanted to point out, November is Native American Heritage Month. It's Alaska Native Heritage Month. It's Indian American Heritage Month, and it's also Epilepsy Awareness Month. So keep those in mind this month and perhaps educate yourself on some of those different areas, okay? There is no Friday Focus next week. Next week will be the Friday before our fall break, so enjoy the time with your family and friends. Friday Focus will return on December 6th. December 6th. So I have the chat. I'm going to pause for just a moment, or I'm going to stop the recording. So stay tuned, everybody that's with me right now. And for those of you who are listening to this recording, thanks for listening. And be back on December 6th.